Hello everyone, this is Carrie Anderson. Hope you all doing well. In today's video, I'll be talking about risk factors for type 2 diabetes. So, if you like the video related to my health, my way, I would like to request you all please to subscribe the channel, hit the bell icon, or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. We may not understand the exact causes of type 2 diabetes, but we do know that certain factors can put you at increased risk. Now, I'll be talking about the certain factors that are out of your control. Your risk is greater if you have a brother, sister, or parent who has type 2 diabetes. You can develop type 2 diabetes at any age, but your risk increases as you get older. Your risk is particularly high once you reach 45 years old. African Americans, Hispanic Americans, Asian Americans, Pacific Islander, and Native Americans. Women who have a condition called polycystic ovarian syndrome are at increased risk. You may be able to change these factors. Being overweight means that you have more fatty tissue, which make your cell more resistant to insulin. Extra fat in the abdomen increases your risk more than extra fat in the hips and thighs. Your risk increases if you have sedentary lifestyle. Regular exercise uses up glucose and helps your cell respond better to insulin. Eating a lot of junk foods or eating too much wreak havoc on your blood glucose level. You are also at increased risk if you have had gestational diabetes or prediabetes, two conditions caused by elevated glucose level. Now, I'll be talking about the receiving a type 2 diabetes diagnosis. Whether or not you have prediabetes, you should see a doctor right away if you have the symptoms of diabetes. Your doctor can get a lot of information from blood work. Diagnostic testing may include the following: hemoglobin A1C test. This test measures average blood glucose level for the previous 2 or 3 months. You don't need to fast for this test, and your doctor can diagnose you based on the result. It's also called a glycosylated hemoglobin test. Fasting plasma glucose test. This test measures how much glucose is in your plasma. You may need to fast for 8 hours before having it. Now I'll be talking about the oral glucose tolerance test. During this test, your blood is drawn 3 times before 1 hour after and 2 hours after you drink a dose of glucose. The test results show how well your body deals with glucose before and after the drink. If you have diabetes, your doctor will provide you with information about how to manage the disease, including how to monitor blood glucose level on your own. Dietary recommendation, physical activity recommendation, information about any medication that you need. You may need to see an endocrinologist who specializes in the treatment of diabetes. You will probably need to visit your doctor more often at first to make sure your treatment plan is working. If you don't already have an endocrinologist, the Healthline Find Care tool can help you find a physician in your area. Early diagnosis is key to proper diabetes management. Find out more about how type 2 diabetes is diagnosed. Tips for how to prevent type 2 diabetes. You can't always prevent type 2 diabetes. There is nothing you can do about your genetic, ethnicity, or age. However, a few lifestyle tweaks can help delay or even prevent the onset of type 2 diabetes, whether or not you have diabetes risk factors such as pre-diabetes. Now I'll be talking about the diet. Your diet should limit sugar and refined carbohydrate and replace them with low glycemic whole grains carbohydrate and fiber. Lean meat, poultry, or fish provide protein. You also need heart healthy omega-3 fatty acid from certain kind of fish, monounsaturated fat and polyunsaturated fat. Dairy products should be low in fat. It's not only what you eat, but also how much you eat that matters. You should be careful about portion size and try to eat meals at about the same time every day. Now I'll be talking about the exercise. Type 2 diabetes is associated with inactivity. Getting 30 minutes of aerobic exercise every day can improve your overall health. Try to add an extra moment throughout the day. Now I'll be talking about the weight management. You are more likely to develop type 2 diabetes if you are overweight. Eating a healthy, balanced diet and getting daily exercise should help you keep your weight under control. If those changes are not working, your doctor can make some recommendation for losing weight safely. The bottom line, these changes in diet, exercise, and weight management work together to help keep your blood glucose levels within the ideal range all day long. Discover how curcumin, vitamin D, and even coffee can also help you prevent type 2 diabetes. Now I'll be talking about the complication associated with type 2 diabetes. For many people, type 2 diabetes can be effectively managed. If not properly managed, it can affect virtually all of your organ and lead to serious complications including skin problems such as bacterial or fungal infection, nerve damage or neuropathy, which can cause a loss of sensation or numbness and tingling in your extremities, as well as digestive issues such as vomiting, diarrhea and constipation. Poor circulation to the feet, which makes it hard for your feet to heal when you have a cut or an infection, and can also lead to gangrene and loss of the fat or leg, hearing impairment. Retinal damage or retinopathy and eye damage, which can cause deteriorating vision, glaucoma, and cataract. Cardiovascular disease such as high blood pressure, narrowing of the arteries, angina, heart attack, and stroke. Now I'll be talking about the hypoglycemia. Hypoglycemia can occur when your blood sugar is low. The symptoms can include shakiness, dizziness, and difficult speaking. You can usually remedy this by having a quick fix food or beverage such as fruit juice, a soft drink, or a hard candy. Now I'll be talking about the hyperglycemia. Hypoglycemia can happen when blood sugar is high. It's typically characterized by frequent urination and increased thirst. Exercising can help lower your blood glucose level. Complications during and after pregnancy. If you have diabetes while you are pregnant, you all need to monitor your condition carefully. Diabetes that poorly controlled can complicate pregnancy, labor, and delivery. Harm your baby's developing organs, cause your baby to gain too much weight. It can also increase your baby's risk of developing diabetes during their lifetime. The bottom line, diabetes is associated with a range of complications. Women with diabetes are twice as likely to have another heart attack after the first one. Their risk of heart failure is 4 times that of women without diabetes. Men with diabetes are 3.5 times as likely to develop erectile dysfunction. Kidney damage and kidney failure can affect both women and men with the disease. Take these steps to lower your risk of kidney damage and other diabetes complications. Now the type 2 diabetes in children. Type 2 diabetes in children is a growing problem. According to the American Diabetes Association, around 193,000 Americans under age 20 have type 1 or type 2 diabetes. One study found that the incidence of type 2 diabetes in youth has increased to about 5,000 new cases per year. Another study showed a significant increase, particularly in minority races and ethnic groups. The reasons for this are complex, but risk factors for type 2 diabetes include being overweight or having a body mass index above the 85th percentile, having a birth weight of 9 pounds or more, being born to a mother who had diabetes while she was pregnant, having a close family member with type 2 diabetes, having a sedentary lifestyle, being African American, Hispanic American, Asian American, Native American, or a Pacific Islander. The symptoms of type 2 diabetes in children are the same as those in adults. They include excessive thirst or hunger, increased urination, sores that are slow to heal, frequent infections, fatigue, blurry vision, area of darkened skin. Now see your child's doctor immediately if they have these symptoms. In 2019, the ADA recommended that all children who are overweight and have additional diabetes risk factor be tested for prediabetes or type 2. Untreated diabetes can lead to serious and even life-threatening complications. A random blood glucose test may reveal high blood glucose level. A hemoglobin A1C test can provide more information about average blood glucose level over a few months. Your child may also need a fasting blood glucose test. If your child is diagnosed with diabetes, then their doctor will need to determine if it's type 1 or type 2 before suggesting a specific treatment. You can help lower your child risk by encouraging them to eat well and to be physically active every day. Get more information on type 2 diabetes, its effects on children, and how it's becoming so common in this group that it's no longer known as adult onset diabetes. Statistics about type 2 diabetes. The Center for Disease Control and Prevention trusted source report the following statistics and about diabetes in the United States. Over 30 million people have diabetes. That's around 10% of the population. 1 in 4 people have no idea they have diabetes. Pre-diabetes affects 84.1 million adults, and 90% of them are unaware of it. Non-Hispanic, Black, Hispanic, and Native American adults are about twice as likely trusted source to have diabetes as non-Hispanic white adults. The ADA report the following statistics. In 2019, diabetes cost the United States $327 billion in direct medical costs and reduced productivity. The average medical expenses for people with diabetes are about 2.3 times higher than they would be in the absence of diabetes. Diabetes is the 7th leading cause of death in the United States, either as the underlying cause of death or as a contributing cause of death. The World Health Organization trusted source reported the following statistics. In 2019, global prevalence of diabetes was 8.5% for adults. In 1998, only 4.7% of adults worldwide had diabetes. Diabetes directly caused about 1.6 million deaths worldwide in 2016. Diabetes nearly triples the risk of heart attack and stroke in adults. Diabetes is also a leading cause of kidney failure. Diabetes impact is widespread. It touches the lives of nearly 500 million of people around the world. View some infographic that shine a light on other diabetes statistics you should know. Managing type 2 diabetes. Managing type 2 diabetes requires teamwork. You all need to work closely with your doctor, but a lot of the results depend on your action. Your doctor may want to perform periodic blood tests to determine your blood glucose level. This will help determine how well you are managing the disease. If you take medication, these tests will help gauge how well it's working. Because diabetes increases your risk of cardiovascular disease, your doctor will also monitor your blood pressure and blood cholesterol level. If you have symptoms of heart disease, you may need additional tests. These tests may include an electrocardiogram or a cardiac stress test. Now follow these tips to help manage your diabetes. Maintain a balanced diet that includes non-starchy vegetable, whole grain fiber, lean protein, and unsaturated fat. Avoid unhealthy fat, sugar, and simple carbohydrate. Achieve and maintain a healthy weight. Exercise daily. Take all your medication as recommended. Use a home monitoring system to test your own blood glucose level between visits to your doctor. Your doctor will tell you how often you should do that and what your target range should be. It may also be helpful to bring your family into the loop. Educate them about the warning signs of blood glucose level that are too high or too low so that they can help in an emergency. So that's all about the diabetes in this video. I hope you all liked it. For all of you, I've prepared a small presentation that will be going to share in the description box below. You can check it out from there. So before signing off, I would like to request you, please do like, share, subscribe this video with your loved one so that they will get to know better. So this is Carrie Innocent signing off. We will definitely meet in the next video with my another content. Till then, God bless you. Bye-bye and take care.